Hey, November is Cancer Awareness Month, and it's possible, we understand, that you can develop lung cancer even though you've never even smoked. Dr. Doug Minnich is a thoracic surgeon at Princeton Baptist Medical Center, and he joins us now with more on what we should know about this disease. And what can you tell us, maybe some things that surprise some people that they hear about causes of lung cancer?
Sure. Well, I think certainly cigarette smoking, in association either with actively smoking or exposure to secondhand smoke, are probably the biggest risk factors for lung cancer. The other point related to tobacco exposure is now what's being referred to as tertiary level exposure, which is exposure to tobacco on inanimate objects, whether it's a table, an elevator button, a door handle, and there actually is now an association with lung cancer in patients who have had exposure at that level.
Oh, wow, I've never heard that. What about the guys that say, well, I'm not doing, I don't smoke, but I dip, so I'm not going to get cancer?
Dipping will increase risks not so much for lung cancer, but can still for other types of cancer, whether it's in the lip or tongue or somewhere else in the oral cavity.
Okay.
So it is still associated with cancer, but not so much lung cancer as it is with the inhaled types of tobacco.
Well, you're saying smoking's still the #1 cause. Are there some other causes? I know when I was in college, they were removing asbestos from the ceilings of our dormitories.
Yes.
People have had past exposure to that, perhaps?
Correct. Certain occupations have had exposures to asbestos, and asbestos does increase the risk of lung cancer. Asbestos in combination with cigarette smoking, those risks are additive as well. Asbestos can also increase the risk for an additional type of cancer within the chest cavity referred to as mesothelioma, which is involving the lung and the lining of the chest wall as well.
And we have a graphic up there that talks about a gene in non-smokers. What is that?
Correct. There are certain genetic mutations now that have been shown to increase the risk of a lung cancer and can actually affect the treatments that are provided in those types of situations. That gets into more of the therapeutic aspects of lung cancer as far as targeted therapy. In the past, 10 patients may receive the same types of chemotherapy. Now there's an effort to identify patient-specific chemotherapy based on genetic markers and different protein expression in order to individualize the treatment and look for better outcomes.
Now, is there some information that people can, with National Cancer Awareness Month, they can get more information, a place they can go?
Certainly. November is Lung Cancer Awareness Month. There are resources on our practice webpage at princetonheartandthoracic.com. The National Cancer Center Network has good resources available on their website as well, and lots of resources available this day and age.
Okay. Well, thank you very much for coming by.
Thank you. Appreciate it.